Hey guys, welcome to Riding Shotgun. I'm your host, Dr. Lorie Lofquist. This podcast is going to take you for a ride in the passenger seat. So climb aboard so that you can get armed with everything that you need to know in order to make health and wellness decisions that are important for your life and your family's life. So sit back, relax, and let's roll. All right, guys, so it's time for another episode of Riding Shotgun with Dr. Lorie Lofquist, and I am here today to talk to you about children getting adjusted. I want to talk to you about this because a lot of people always ask, and they're so shocked whenever they see that I just adjusted a 2-year-old or I adjusted a 6-day-old baby, or I was at the hospital when a baby was delivered and they were minutes old when I gave that child their first adjustment. And a lot of times people are like, well, Doc, why would I bring my kid to see you? My kid's healthy. They're not having any problems. Why would I do that? That's a great question. Let me answer that for you. So recently I was reading in Well-Adjusted Baby, actually, the top 10 reasons why parents like to take their kids to see a chiropractor. So the first one that they mentioned was it increases brain and nerve development. And that's absolutely true. If you're starting to build a house and you're building it on a crappy foundation, the house is going to be crap. The same is true whenever a child's developing. If the child has something that can be fixed and you don't fix it, but you continue to let that child grow and develop, they're going to have future problems. I mean, it's just going to happen. So that's number one. Number two, it enhances their overall well-being. I have patients all the time, well, parents of patients actually, that say, oh my gosh, can you give them an attitude adjustment? They sleep so much better when they leave here. They act so much better. They listen better. Can you please just give them that attitude adjustment? Which I'm not technically giving them an attitude adjustment. I am just helping them function better. But it makes the child happier just overall. Number three, increase the immunity and reduce illness, earaches, colds, and flus. So true. Chiropractic increases your immunity by 48%. 48% at a minimum. It's fantastic. It makes everything work more efficiently and more effectively. It can help with your digestion. Let me tell you, if I would have known about chiropractic with my son when he was a baby, it would have saved so many sleepless nights. My son had the worst colic of anybody I have ever met. I mean, he just screamed and just a blood-wrenching, horrible scream. And you knew he was in pain, like you could tell. He was definitely in pain. And eventually all the doctors finally did for me was, here, take this prescription medicine to drop the acid in his stomach. What? I didn't know any better at the time. My child did not have an overproductive stomach that was producing too much acid. That wasn't the issue. He didn't have the gas bug. He didn't need Mylicon drops. He needed his body to be functioning correctly. So I gave my kid all of this medicine, but I have kids all the time come in with horrible, horrible colic. And mom calls in the next day like, oh my God, Dr. Lorie, thank you. Finally, we have gotten a full night's sleep. And that's just the beginning of it, guys. That's just the beginning. So the next thing that this article mentioned was that it'll help with seasonal allergies and asthma. Now, I don't typically tell a parent, yeah, sure, throw away the inhaler. That's great. No big deal. The inhaler's there for a purpose. If a child has an asthma attack, they probably need that inhaler. They're that bad. However, with allergies, with asthma, getting an adjustment was just open up the chest cavity so that the child can breathe better. And this goes for, even CF patients that have lung compromises. It helps them breathe so much easier after they've been adjusted. They can feel the difference. They can take a deep breath and it doesn't hurt. It doesn't feel tight. It doesn't feel congested. The next thing that this article mentioned was that it improves your spinal posture. Well, duh. We're correcting the alignment. We're making the alignment the way that it's supposed to be. So absolutely, it's going to improve the posture. Plus, if you have a chiropractor showing your child how they should be sitting, your child is going to be more conscious of it. They're going to know what's going on. I see a thing coming through my office all the time, and we'll talk about it later, but I've dubbed it Xbox back. And I know all of you have seen it, but the child will come in and one shoulder is so much higher than the other one. You can tell that this child just absolutely leans on something for hours a day. And it could be while they're doing homework, but typically when I ask the kids, so how much Xbox do you play? Common response is, huh? And the parent goes, way too much. So, I mean, they're just leaning against the side of the couch or something like that and playing their video games for too long in one period of time. So going to the chiropractor, we can address that, we can adjust that, we can point out what they're doing and at least find a way that they can change it. They don't necessarily have to quit playing their video games, but they have to be aware of their posture while they're doing so, though they should go outside and play. Anyway, this is a big one. Number 7 in this article was improve the child's ability to concentrate. So nowadays, all these kids are being diagnosed ADD, ADHD. They're getting put on Ritalin. They're getting put on Concerta, same thing, Vyvanse. And it's all because they need you to sit down and focus. Well, one, and we'll talk about this later because we're going to do a whole different segment on this. But one, children are not designed to sit down as long as we have them sitting down per day. They are not. They're not designed to sit in a chair for 8 hours and do their work quietly. That is just not how a kid is supposed to be. A kid is supposed to be active. They're supposed to be playing. They're supposed to be running around. Recesses nowadays are 15 minutes or it's a 20-minute break, lunch and recess. So the kid gets like 10 minutes to run around and play. That's not enough time to actually get the energy out and to make them feel like they can sit down and focus again. That's a big issue that we're having right now with all these kids. Now, I do have to say that I have met some children that could possibly benefit from medication. I'm not saying that all medication is bad, and you've heard me say that before. There's a time and a place for medicine. You should just always try the more natural route first. So before you would move to medications, chiropractic's a perfectly natural, healthy alternative to get these kids to concentrate better, to focus better, to be better at doing what they're supposed to be doing at school. The other thing that we can do is we can actually evaluate them nutritionally. There's lots of things that these kids are sensitive to in our food supply, and that just agitates the issue and makes it harder for them to concentrate and for them to focus. You can use herbal supplements. You can use vitamins. There's tons of things that you can do. Just give us a call. We'll go over all of those with you. Definitely give it a try before you resort to pharmaceutical medication that they're potentially going to be on for the rest of their life. Number 8 on this was that it'll improve the emotional well-being. And we kind of touched on this before. It really does. The child just in general is happier and healthier because everything is firing the way that it's supposed to. Number 9, it can alleviate bedwetting. So this is a big one. And this one, I love telling patients about this, parents about this, because they would say, why does chiropractic help with bedwetting? I know, right? You wouldn't even want to make that connect. I mean, how could you possibly say, oh yeah, that definitely is doing it? Chiropractic adjusts every part of the body. Just simply by the adjustment itself, it is going to ripple effect into every part of the body. Lots of times with bedwetters, there's a couple of things going on, but lots of times I find that they have sacral misalignment. So that bottom pie-shaped bone in the bottom of their spine is out of whack. And up until age 5, that bone is actually 5 separate bones. So when I adjust it, I can move each individual section. Now, if I don't get to it before it's fused at age 5. Now we've got not a badly shapen sacrum, but maybe one that's not shaped perfectly right. And then you would ask, why would it be misshapen? Have you seen a toddler lately? How often does a toddler fall? A couple big falls, they could push a couple of those bones a little bit out of whack. They're going to fuse at age 5. So you should definitely have your child checked before age 5 just to help make sure that sacral alignment is perfect. But in addition to that, the bedwetting issue. You should have your child checked to see if they have a dairy sensitivity. There was a study, I read it a long time ago, I'll see if I can find it, but it basically said that they found that children who have abnormal bedwetting, so bedwetting above what would classically be normal, dairy sensitivities. These kids crave milk, they want milk, but they're sensitive to it. They're allergic to it in some way, shape, or form, and that's causing them to have some bedwetting. Now, I know that there's other issues going on here too, but chiropractic can definitely help with bedwetting. Last one. This goes for babies. This goes for 2-year-olds. This goes for 5-year-olds. This goes for 17-year-olds. Chiropractic will help that child sleep better. They will sleep more soundly. They will sleep more peacefully. They won't have any aches and pains. And the one thing that oftentimes will get parents not upset, but get parents really thinking is a child that's born and has a subluxation. has pain, has some sort of discomfort, has some sort of symptom that goes along with that subluxation. They don't know how to express it. So a baby that's born and has an abnormal alignment of the spine may have headaches, but they've had headaches from every day that they've been born, and they can't tell you. So whenever you're looking at this child and this child is super cranky all the time, or they're always irritable, or they're always, super duper fussy, and you're wondering like, what is wrong with this kid? I fed it, I changed it, I've done everything to it. It could be that they have a spinal misalignment that's causing them some sort of irritation, some sort of pain syndrome that they can't express. And they don't know that it's different because they've had it for so long, all of their life. I actually had a baby. She was 6 months old. Mom came in. She's been a longtime patient of mine. Her older daughter had been seeing me. She was in gymnastics. The daughter had hurt herself doing a back bend. We got her adjusted. She was feeling better. She could now do all of her flips and back bends and everything else without any pain. She decides she wants to bring in her 6-month-old child because the 6-month-old child is just not acting right. She's not sitting right. She's always leaning to one side. But she's not super fussy. She's a good baby. But mom just wanted to have her checked out. So we're palpating her back. I'm feeling it. Get to this spot. And I said, oh, this is interesting. When you feed her, when you nurse her, is she arching her back a lot? And mom goes, yeah, all the time. She arches her back all the time. I said, yeah, there's this big spot right here that I think we need to adjust. Mom says, oh yeah, do it. I said, okay. So I picked the child up, and on babies and toddlers, it's super gentle. I mean, you wouldn't even know it if they didn't make the popcorn. I call it popcorn. If they didn't make the popcorn sound. So I picked the baby up. I'm holding her. I lean her back. I gently adjust that one spot. This 6-month-old baby goes, Mom nearly jumped out of her chair. She couldn't believe it. She's like, oh my God, did she just sigh? And I looked at mom and I go, yeah. And so after that, mom comes back in. She's like, I cannot believe it. Her bowel movements are normal. She's actually having one every day. Which, if you don't know that, you should be having a bowel movement every day. She's actually sleeping better. She's nursing better. She's feeling great. Now, there wasn't anything wrong with this baby per se to begin with, but this baby has a much better quality of life now that chiropractic has been brought into it. Anyway, I hope this clears up some information as to why you would bring a relatively healthy child in to see a chiropractor. We can go in depth with any more of these. If you guys have any questions, concerns, comments, please post below. Make sure you rate this podcast. Let me know what you guys want to hear about. Put it down in the comments down there. You can always send us an email or give us a call. I always look forward to talking to you guys. Thanks for listening. Good night. Hey guys, what a ride. I hope you enjoyed it. Now that you have been armed with that knowledge, I want you to go out and apply it. Know someone who could benefit from this info? Please share it with them. We'd love to hear from you. Call or text us at 636-678-4342. Or better yet, stop in and say hi the next time you're around our Fenton, Missouri office.